I was in a fortunate position as chair of psychiatry at the university and CEO of one of the smaller teaching hospitals, the Clarke Institute of Psychiatry. In that role, I could see both how there was a great need for more care and research in psychiatry and mental health, but also that the province had changed, and there was now real concern about the deficit, running at about $10 billion a year, how expensive healthcare was, and within that hospitals were the major driver of healthcare costs. We were getting budget cuts, as was the hospital next door, the Addiction Research Foundation. When a new government came in, the Conservatives of 1995, they were making all kinds of noise to improve hospitals by consolidations. So we started by going to the people next door, the Addiction Research Foundation, because we had many commonalities. Our patients half the time had an addiction. We were studying the same problems, whether it's trauma early in life or neurotransmitters, suicide. We had so many overlapping interests, and we were both being hurt by budget cuts, and we were so close. But also we weren't teaching the next generation of clinicians about mental health and addictions, about why they go together and what you can do about it. So we had a series of meetings and we couldn't agree on very much. ARF was a logical partner for many reasons, but our cultures and philosophies were so different. We just couldn't agree on things when we had options or choices. So later that year, probably around the beginning of 1996, through the provincial government, we started a series of meetings with Queen Street Mental Health Centre, and those meetings were progressing as how we might link the two in a good way for everybody. Those meetings were progressing when the government announced what was a restructuring commission under Duncan Sinclair. This commission was to rationalize hospitals in Ontario, and the board chair here and I made a presentation linking the three, Queen Street ARF and the Clarke Institute. 6 months later, when the commission announced its findings, and they're more than recommendations, they were directives, you had no choice. They linked 4 hospitals to one. The 3 we had discussed, and the Donwood Institute, which none of us had thought much about. It was smaller, it was for people with alcohol problems, and in a different part of the city. It turned out to be brilliant to link the 4 because we had 2 mental health facilities, 2 addiction facilities, 2 academic, 2 clinical. They focused on different kinds of problems. I also developed a feeling that because there were 4 and because we had no choice, it actually made it a bit easier. You had shifting alliances. You couldn't say this one was the enemy and this one was my friend. You all had to get along and you all had to fight. Mergers are draining, they're exhausting, they hurt some people, so they have to be really good to make them worthwhile. And this is one that is spectacular. So many people are better off because of CAMH.